Yeah, like you mentioned, Chris, my name is Damazo Kadengye, and today I'm going to talk a little bit about the politics of fundraising. I raised this topic because I thought that the statistician, sometimes we either sometimes do not appreciate the capacity that we have, or we've been raised to think that we are supposed to be support staff. So as a way of introduction, yes, Damazo Kadengye, I was at Hasselt in 2007 and 2009. And then thereafter, I did my work, my PhD at Leuven. So in terms of what I'm just going to talk about, just give you a little bit about me since graduation from my master, and then about my present work. And then I would just touch a little bit on funding for public health research, my experiences basically, and then I give some tips and then talk about some few areas of my interest as well. So yeah, so since 2009, I went on to go to Leuven and I did my PhD in applied statistics. And
sorry, Trevor, to interrupt, but your slide is frozen.
Oh, okay, all right. So thank you so very much. So yeah, and I will not repeat this, but I just mentioned that I'll talk a little bit about myself since graduation, talk about my present work, and talk a little bit about what I have learned in public health research, specifically with the focus on my experiences with respect to funding, and with the focus on the role of a statistician, or where we belong, or what we needed to do as statisticians in terms of attracting funding for statisticians in public health research. And then I will offer some few tips, and then briefly talk about my other areas of interest. So Chris, you let me know if the slides are moving. So since 2009, I have done my PhD. I did my PhD in applied statistics at Leuven. And immediately after graduation, actually it was a little bit before I graduated, I was recruited as an epidemiologist. Now I've put up this slide mainly to show you can see a few highlights that I've given there to show that like some sort of how diverse somebody from Hasselt or from the ICP program can be. Because immediately after, just before my PhD, I was recruited as an epidemiologist, but with a major emphasis on implementation science research in public health. This was at the US Center for Disease Control and Prevention. At that moment, it was a bit, even when I applied for this position, I was so sure whether I would be mainly because at that particular moment, I knew I was a real statistician. And now I was applying for a position in epidemiology. But when I was interviewed, I just found that the questions were really relevant to what we had learned from the program, especially at Hasselt. And then, so why I mentioned this is that sometimes most of us tend to restrict ourselves to the word statistics. And maybe we think we cannot deliver or we cannot perform very well in other areas, especially like epidemiology. And I'm really very happy that this workshop is focusing on both, on all programs of ICP. So there are lots of interactions within for epidemiologists and the statisticians, especially when it comes to public health research. Thereafter, I did teach at 2 universities in Uganda. And that was at Berkeley University of Science and Technology, as well as Makerere University, Kampala, Uganda, where I served as a senior lecturer for epidemiology and biostatistics. So I was teaching epidemiology and biostatistics at Berkeley University of Science and Technology, while also teaching statistical methods at Makerere University, School of Statistics and Planning. And in between there, I was able to, I went to Sweden at Karolinska Institute as a fellow in biostatistics, and they also went to UC Berkeley in the US as an impact evaluation methodologist. So that was also a fellowship. Now, immediately after my fellowship at UC Berkeley, I came back to East Africa and immediately headed to Kenya where I was recruited as the head of data measurement and evaluation. And this was at the African Population and Health Research Center. So just briefly, that is how my career has spanned since 2009. But also to mention that in between there, I have done quite a number of consultancies and teaching and short courses, and I will talk about those very briefly later. Since 2009, I've also been able to publish over 30 peer-reviewed publications in high-impact journals, and I've also authored over 10 technical research reports, blogs, and policy briefs. So the last line there, I show that since, I think this is actually since I graduated from my PhD, I have also been able to raise about 3.5 million US dollars in research support as a lead of projects or as a co-lead, a PI or a lead. And then I have also been able to raise about 15 million US dollars collaboratively. So collaboratively here I mean either as a co-investigator or as a statistician, but at least I have been in those projects where I am proactively involved in the writing of the research grant. So basically that is about my profile. Now, just very briefly, at APHRC, we operate in over 20 countries in sub-Saharan Africa. So this map is for 2020. I think right now we should be in about 25 countries. We have our offices in Nairobi and we have another office in Senegal. Then our work is basically to generate research evidence, strengthen research capacity, and engage policy to inform action, population health, and well-being. And our mission basically is to use evidence to impact and transform lives in Africa. So this evidence that is obtained through research. And now this one here, Chris, can you let me know if you are still with me?
Yes, I hear you.
Thank you. Yeah, so what I'm showing here, I just really wanted to show, back to what I mentioned at the beginning, the power of a statistician or the power of an epidemiologist, if I can use that word. But I just want to focus on statistics here, mainly because I graduated as a statistician. So as you can see here, you will note that at APHRC, which is really a premier research institution in Africa, APHRC boasts of about 180 staff. And of these 180 staff, about 70, between 60 and 70, I don't have the statistics right now, but as of at the end of 2020, 65 of the 180 staff were PhD holders. And these PhD holders, they just come from across different parts of the continent, mostly from Africa. And they also cover a number of disciplines. So demographers, epidemiologists, medical doctors, in different areas, people who are focusing on education and etc. So what we have here, we have 4 divisions. We have the division of research, we have the division of research capacity strengthening, and we have the division on policy engagement and communication, and then lastly we have another division called operations. But I wanted to focus here, which is the research division actually has about 80%, or the research division is about 80% of the entire of APHRC as an institution. So the department or the unit that I lead here is called data measurement and evaluation, and our job is to support all these 6 research programs or departments, as you may want to call them. But we also offer support to research capacity strengthening, especially in the context of monitoring and evaluation. And we also support the policy engagement and communication also in terms of monitoring and evaluation. The program that we do not support so much is this one on operations. So this is really the strength that we have here at APHRC. And this is what the areas that I lead on, that my team, I have a team of about 40 staff. And these 40 staff are clustered in these 3 areas. One is on surveillance and evaluations, where we have evaluation specialists. We have some research officers actually, but these research officers are actually focusing on data. not necessarily the usual research. So I have a project under my unit called the Health Demographic Surveillance System. So we have a project manager there, and we have some community liaison officers and the field staff. Then we have another sub-unit called the Robust Data Systems, where we have software developers. So these are data systems developers, people who deal with some SQL and development of data entry screens and etc. So we have some data managers there that focus on quality assurance and quality control, and we have some data scientists there that are focusing on data visualizations and data mining and etc. And then we have also another team that focuses on that has data analysts and statisticians. Now, that is about APHRC and what I do. So here, I really wanted to show that in public health, research funding is awarded via a competitive or merit-based process, and this is really not news. And what I have learned so far is that not all people that apply for funding are actually funded. At APHRC, our success rate is about 11%. So in a year, we write about, I told you we are about 65 PhD holders, and each of these PhD holders, at least in a year, writes quite a number of, as a read of proposals for funding. And we respond to requests for proposals, etc. Our success rate is about 11%. That means when we write about 100 proposals in a year, only 11 will be funded. So that is how serious this work can be. But I'm showing why I put this picture here, which I got from CDC here, is to show that this is like 2012. It shows that when you look at these areas here that usually attract funding, you are not going to see their statistics here. You will not see that. So these are different disciplines or different diseases, etc. So now the question is, then where do you find yourself? And this is the question I used to ask myself when I joined APHRC, even when I was still teaching. Now, that's what I mentioned. Some funding is allocated according to preset formula or priority areas, maybe because of the severity of the disease. Right now, a lot of funding is going with HIV and COVID-19, etc., and malaria, and of course, like that. So the question is, as a statistician, where are you? Statistics is basically a profession, so now how do we go about it? And then also, some awards can be made directly to government health departments at all levels. They can be made to non-profits, academia, businesses, etc., but sometimes also to individuals. What I am showing here in this picture is the way funding has been given to APHRC, like across the different research units that I showed. So in 2014, as you can see here, this small blue bar is for the data and the statistics, the unit that I read. As you can see here, you will see that a lot of funding is going to health systems, a lot of funding is going to reproductive health, a lot of data funding is going to education and youth empowerment. And then, of course, the green one, which is about aging, you can see is also there struggling to the data and the statistics. So what I mean by the data and the statistics, this is funding that comes directly to us as a unit, as a department. And although we contribute and we support all other these other units that I mentioned before, but we also go ahead and solicit funding on our own. So for instance, to support government departments to set up their statistics units, to conduct some visualization, some data visualization. The gray one with the maternal and the child health was not part of the units at APHRC in 2014, 2015, and 2016. And even when it started around 2017, but you can see, even when it came in 2017, it immediately surpassed the data and statistics. As you can see, it was data was okay. Then in 2018 it went up, 2019 it went up, and 2020 it went up. So, but as I put there a small trend line to show you that even for us, for our data and statistics, we've been growing over the years. So the idea organizations and funding agencies from my own research that we dedicate money and funding to data and statistics. Most of the time part and parcel of the other research units. And if you keep it in that mode, then you are swallowed up by these other disciplines. So in this slide here, I have just put up just a sample of the ones where we are the ones who are reading as data and statistics, not necessarily as part and parcel of the other research units. So I mentioned earlier that in my own capacity, ever since joining the APHRC, I've been able to raise about 3.5 million as the aid, but also about 15 million. Here I'm focusing on the 15 million where I've been providing research support to other units. But this is where we've decided, I talked to my team members and I said, guys, we can also go ahead and get this funding and also put our names on the funding map. So if maybe just to mention like one or two. So for instance, we received about $4 million with my colleague who is based in Senegal, and I colleague here on setting up, we have set up a regional testing hub for strengthening subnational data systems in sub-Saharan Africa. This project funded by Bill and Melinda Gates is to be implemented in 6 countries, 4 countries in West Africa and 2 countries in East Africa. This was awarded at the beginning of this year. The other one, as an example one, is the most recent one, which is focusing on building a data hub and applying artificial intelligence and data science to support public health and economic decision making in Kenya and Malawi. So this is about heterogeneous, harnessing heterogeneous COVID-19 data. Related to this one here, I collaborated with the UCL and the ICRW, so that is UCL, University College London, to set up a database for gender disaggregated data for COVID-19. Also received the funding of about 600,000 from the Gates Foundation. So these are just examples they like to go out and say, okay, can we be the ones to read the evaluation? Okay, so I don't know where you lost me, but I was just finishing up.
Okay.
Yeah, I was just finishing up.
We had some troubles. Yes, please.
Okay, I was just finishing up with a few tips here. That one of the ways to make these achievements is to define a niche. So you've got to brand yourself, e.g. through peer publications, through teaching, and through writing some. Ready to collaborate with and some collaborators that was different parts of the world. I need to be part of a community of practice. So, for instance, belong to national and regional professional bodies. And then, of course, I've already mentioned, like, you need to take initiative to read, to reach out to funding agencies without necessarily waiting for the subject matter experts to hold you at some point. You need to take a read. And I do is, this is something that I also do in order to continue branding myself, that I am involved in teaching at doctoral, undergraduate, and I also participate in professional development courses. So quite a number there that I teach within the East African region. So yeah, so that's all that I wanted to share with you today. And thank you very much for listening about the issue. What you, Chris?